All right, good morning, good afternoon, good evening, depending on where and when you are watching this Facebook Live. This is the voice and the face of Dr. Tolu Olabintan, CEO, founder of Living Spring Family Medical Center in the awesome city of Mansfield, Texas. I'm excited again this morning to be doing another Facebook Live, all in the hopes of helping our patients live long and because we believe that the quantity of life is just as important as the quality of life. And I'm excited to be here today to talk with the awesome Dr. Heather Dean. And we'll be talking about the topic, Doc, I'm having issues with my hearing. What's next? Thank you, Doc, for being here. How are you?
Good. How are you? Thanks for having me on.
All right, awesome, awesome, awesome. Now, I already introduced your name, but please kindly introduce yourself to the viewers. Who are you and what do you do?
Sure. So I am Dr. Heather Dean. I am the only private practice doctor of audiology in Burleson, Texas. I'm owner and audiologist at Burleson Audiology Clinic, and we do hearing tests, pediatrics to geriatrics, wax removal, dizziness, cochlear implants, tinnitus treatment, and hearing aids and hearing aid repairs and things like that. So we can diagnose all your
Awesome,
hearing problems and treat them as well.
awesome, awesome, awesome. Now, why do you do what you do? Like, what got you into here? Like, what? Why? Is
Sure.
there a
So
story
I
behind
kind
that?
of have like two stories that combine. My mom is completely deaf in one ear due to ototoxic or
Wow.
toxic to the ear medication that she took for severe sinus infection. And so I just remember as a kid waking up one day and she came into my room and she was crying, and I said, "Mom, why are you crying?" And she said, "I remembered that." She said that the hearing in one ear, in my good ear, had gone out, and I might not be able to hear
Okay.
the birds one day. And so that just kind of stuck with me. Then when I got into college
Wow.
and was flipping through like the class schedule book, um, I'd heard friends talk about wanting to do homework for communications, and I was like, well, that sounds cool. I want to do communications homework because it was just the way they would talk about the class. And so they right above communications in the class handbook was communicative disorders. I took the intro and loved it and went audiology versus speech pathology. So those are kind of my pathway to
Wow.
getting into the field of audiology.
Cool. Cool.
Yeah,
I like that your passion to not let people feel the way your mom did
yeah.
empowered you to enter this field. So this is good. I like what you do, and our patients are happy to have you their hearing and needs. Now, next question I have for you is this: what are the most common causes of hearing issues that you see?
Yeah, so there are many ways that hearing can be lost. Sometimes it can just be hereditary from family history. There can be medical hearing
Okay.
losses where we're pretty much all familiar with fluid in the ear, like a kid with infection. So that's more of a conductive or a medical hearing loss. There's also nerve damage hearing
Okay.
loss where just like the rest of the body, as aging happens, the body starts to break down a little bit, and so the hair cells, it's part of the nerve that we hear with, start to break down. Noise induced hearing loss is also something that I see often. That's where wearing the earbuds all the time at a too high of a level, or lawnmowers, power tools,
Mhm.
farm equipment, work environment without wearing hearing protection can cause hearing loss when it's at 85 decibels for more than 15 minutes or so.
Okay. So constantly hearing loud noise, not too good for the ears. Um,
Correct.
there's
Yeah.
also
You need to
loud
protect what
music.
you have.
True, true, true. Now, when should one have a hearing test? And I know that's pretty broad. We can start from, maybe pediatric and then, little chunks and then adulthood. But when should one
Sure.
have a hearing test?
So most newborns are screened before they leave the hospital, or at least a month within being born, if not born at a hospital. And then if hearing loss is noticed or concerns are noticed, there's typically screenings during school for kiddos. And then as an adult, really not until the age of 55 should you have it as part of your annual hearing or annual wellness exams. But if there's any kind of notice of having to ask people to repeat themselves or, having ringing in the ears, dizziness, things like that, then it's always good to start with a hearing test because our ears control our balance system, whether we realize that or not. So the ears are such a tiny, small part, but they play a big part into everything that can be going on. So those are kind of time frames. But again, if you notice or have concerns, always come in to get that tested.
And sometimes sometimes people may not notice it first because they are adjusting. And so you mentioned that if you're having to repeat, asking like, "Can you repeat that?"
Yeah.
Then that's a sign that something is going on. And of course, for children, ADHD or some spectrum disorder, sometimes it's important. Hearing is not the issue. Or it's not
Mhm.
contributing
Mhm.
as
We want
well.
to rule
So,
out hearing loss in that case. Yeah.
yeah.
And family members oftentimes are the ones that notice someone's hearing loss first. They'll say, I said this, but you did this because you didn't hear or understand me. And so oftentimes family members are the ones that pick it up first and they have to kind of convince someone, hey, let's at least go get it tested. So I see that often.
True, true. Now, are hearing tests different for a child compared to an adult? So I've had some patients when I say I'm going to send your child for a hearing
Mhm.
test. They're like, "Oh, well, how is that going to work since they're a
Sure.
baby?" How
They
question?
are a
What's
little
the difference as
different.
far as
So, if they are a young child, 3 and under, they're not really gonna be, "Yes, I hear the beat, raise your hand when you hear the beat." They're probably not gonna be able to respond and have consistent responses. So, we can do what's called distortion product otoacoustic emissions, where we just put a little probe in the ear, it sends a signal into the inner ear, and the inner ear actually sends an emission back out, and that's what we register, and there has to be a certain level that emission needs to be at for passing. So 3 and under, that's what we can do. Typically, over the age of 3, they can start responding, whether it's if we tell them to point to body parts or repeat words and then respond to the tones by saying yes or I hear it or just raising their hand, those type things. So then as you get on to be an older child, an adult, it is the headphones and you respond to hearing the tones and the beeps, repeating words, and those type things. So yes, they are different, but we are able to test 3 and under without them having to actually respond. It's just their ear.
right, right. Now, is it a painful procedure? I've had a patient ask me that, like, "Oh, they're gonna put stuff in the baby's ear. Like, does it hurt the baby? Is the baby like? What would you say to that?"
No, it's not painful. It's soft little probes. And even, some of the kids that are old enough to kind of understand, I let them play with the probe and say, look, it's going to, or I'll
Okay.
match it to their shirt color and things like that. But no, it's not a painful procedure. Babies just, if they've had multiple ear infections and have gone to the doctor, they know that there's pain in their ears from their infections possibly, and they don't like people touching their ears, or it's something that scares them and they aren't quite sure how to react because it's something new. But no, it's not painful for anyone.
Awesome. Now, how do you prepare for a hearing test? So for someone who's watching #live and #replay, and they're like,
Yeah.
"Well, how do I prepare? Is there something I need to do? Clean my ears a special way? Um, how do I prepare for the hearing test?"
I have a lot of patients that will come in and say, "Oh, I cleaned my ears for you today." I don't recommend that because, first of all, we shouldn't use cotton swabs in our ears. We shouldn't put anything smaller than our elbow into our ears because that will pack the wax down in there. Our ears naturally migrate wax out every day. And so if you're putting cotton swabs in there, you're just pushing all that work that your ear has done back into your ear. I tell people we have wax in our ears like we have boogers in our nose. It's supposed to be there. It's supposed to keep out all of those things, those foreign objects. And so it's supposed to be there. So, really, to prepare, there's nothing that you need to do. There's no studying for the hearing test or anything like that. You just need to call, make an appointment, and then if there's wax, I can remove it here in the office, and we can proceed on with the hearing test, and see what hearing looks like.
All right. So come as you are.
Yes, come as you are.
Right?
Uh-huh.
Come as you are. That's it. Now, wait. You mentioned don't put anything smaller than an elbow. Did you say elbow? Was that did I
Uh-huh.
in your ear?
Yeah,
Is that what you said?
right. I did.
Okay.
That's what an old ENT that I used to work for, that was his like point of reference, because I mean, your elbow, it's not the smallest thing,
Yeah.
but you don't want to put
Right. It's
anything.
not like
I often hear bobby pins or a pencil or all of these things to even scratch in there. No, don't put those things in your ears. It can easily push that wax down in there, which could end up pushing it to your eardrum, and then you're in a lot of pain.
So what's the whole point of the Q-tip? Is that
That's
more
a
like,
good
and I ask
question.
that question because I have patients who say, I want to clean the outside of my ear. And I say, just limit it. You know how you want to, your ear, make sure you get it clean. But I tell them not to go in, but on the outside, sure, you want to wipe that, you can. But don't
Sure.
go. I wonder if
I don't know exactly when or how the Q-tip was invented. I need to look that up, honestly.
I am
Maybe
going
for
to.
makeup use, putting makeup on, things like that. Now, I tell my patients, use your towel or your washcloth and just wipe your ear and wipe the inside here. Because again, that wax is going to migrate out and it's going to be at the opening, and then you can just wipe it out as it comes. And then I do have some patients that come see me every 6 months, maybe every 3 months, if they have large wax buildup, if they are just a high producer of wax, and then I can remove it. Another thing you can do, if you do not have or have known holes in your eardrums, like from tubes or trauma or anything like that, you can let water run in your ears when you're in the shower, like you're washing your hair. Just tilt and purposely let it in there, because that does help flush it out. Now, if you're prone to outer ear infections, or again, you have a hole in your eardrum that you know of, do not do that. That will be a lot of pain and a lot worse medical situation for you. But just letting water into your ears is going to help flush
Okay.
the wax on out.
If you don't have a hole in your ear and you're
Correct.
not prone
Yes.
to ear infections, very
Yes.
important.
Mhm.
This has been very, very educative. I have enjoyed having this conversation with you.
Yeah. Well, I'm excited to be able to tell your patients what it's like for hearing tests.
Awesome. Now, for those who are wondering, okay, doc, I hear you. I gotta go. I hear you literally. I gotta go get a checkup or take my child for a hearing test. Where can people find you? Where can
So
people find
our address is 121 Northwest Ellison Street, Suite 101 in Burleson, Texas. Make sure you put the Northwest in there, because if you don't, it will take you to Babe's Chicken, and I don't work at Babe's Chicken. We are in Burleson. Honestly, here's another food reference: 2 blocks behind the Dairy Queen off of Wilshire. So most people are familiar with Dairy Queen here in Texas. So you know where the Dairy Queen is, 2 blocks behind it.
Awesome. And we'll put that information at the end of this live in the comment section so people have access to that and they can connect to you. And thank you for the care you give our patients. We
Thank
appreciate
you.
you.
Absolutely.
Thank you. This has been very good. Thanks for you. Thanks to all of you who've watched, those who've watched in live. Hi, Ms. Trailer. Those who are going to watch in replay, be sure to share with those who could find this useful. And once again, if you or anyone you know is looking for an awesome, a thorough, and a passionate family physician here in the Mansfield, Texas area, who cares about helping improve your quality of life so you live long and well, I am she. Have a good one, guys, and thanks for watching.
Bye.
Bye. All right.